Alexander Fleming, if it weren't for Sir Almroth Wright, he would have been a footnote, because Wright, the other people that were involved with the development of penicillin were getting the credit in a London Times article, and Sir Almroth Wright said, hey, don't forget about Fleming. He's the guy in whose culture dish it was found. And if it wasn't, like I say, if it wasn't for Sir Almroth Wright, he probably would not. Now Fleming, everybody thinks it's just Fleming. And of course it wasn't. Fleming gave up on it. Fleming couldn't do anything with it. It was up to some other people picked up on it and made it work. Another person who followed in the steps of Sir Almroth Wright was this Charles Duncan. He called his work autotherapy. He was a little critical of Wright in some things, but he was a student of Wright. And he was advocating, and he didn't use blood, but he used blood, but not. He used it as a menstruum, but not. He didn't specifically re-inject blood, but he did talk about if you have an intra-alimentary, two rules. A general rule was anything that was in the pulmonary or alimentary system, he would take the toxic product, filter it, and then inject it hypodermically. But if it was from outside, like something on your skin or whatever, extrapulmonary diseases, he would go orally administer. So particularly for injuries, there was one of the Surgeon Generals of the Navy was praising this guy's work because it really did work in the battlefield to take the bloody bandage and have the person suck on it right in the battlefield and to abort the infection that was within. So this is, I also spoke about urine therapy and the therapeutic use of urine. And he's basically saying anything, get that, what's causing the disease from the person and use that in its therapy. Autotherapy. I wrote a book on that as well. So then we get like, in getting into this, I just deal with some of the theoretical questions. Well, active versus passive, which we've discussed. Vaccine versus the serum therapy approach. Just interesting, and I won't go real far with this, but that most of what is considered active immunization is extravascular. It's into the tissues. And most of what is considered passive immunization is intravenous. This is a search of Medline citations, looking for active immunization and seeing how many of those are extravascular and intravenous. So we have two different approaches here that persist right into modern times. What's interesting, though, is our hero Rosenau, who we will return to in part 2, sort of shows in his work that it's both. And that's why at first I thought autohemotherapy is just a vaccine. But at the same time, when you have that blood, it starts to coagulate. It starts to react against the enemy in a fashion that there's something about the immune cascade in some of the medical literature, the immune cascade and the coagulation cascade. There are similarities in the mechanisms so that you have something, as blood coagulates, you have something similar to antibodies that's forming. So you're injecting that as well, along with the antigen when you inject autohemotherapy. When I was studying Edward Rosenau, he not only made vaccines, but he also used antibody and created antibody, and he showed that there was a different reaction when he would inject the vaccine versus injecting the antibody. So I'm now, and I would like to see some more tests done with this so that we could actually see what the action is. But he showed very clearly that you do get one reaction when you inject antibody subcutaneously or intramuscularly, and you get a different reaction when you inject the antigen. So it would be interesting to see, do you get both of those with the autohemotherapy compared with the other? But I just wanted to mention that because it still is up in the air. We don't know. But we're moving along on this. This is, I've labeled this field automedical, because it's self-medicine. It's not just the vaccine, it's not the chemotherapy, and it's not just Rosenau's work. I have some questions on alternative medicine, complementary medicine, integrative medicine. I sometimes think that these terms may be more justify the existence of justify the existence of different types of therapies, and many of them work. I mean, it's like there are various, whether you're talking about dietary or other types of things that will of course help, help the person. But of course we want to find out what is the cause and remove the cause and have the most direct type of therapy that directly acts on that cause. So there was somebody in one of the, there was an old doctor, professor, forget his last name, that spoke at one of the meetings I was at the American Academy of Biological Dentistry. And he was saying, he was poo-pooing the alternative and poo-pooing this and said what is right is the correct one. And of course to him the correct one was some type of shark's tooth type of thing, which may be the right way. But I thought this was, and I'm sorry this doesn't show up well, it showed on well on PowerPoint, it will on slides, but these are a chart of bloodletting, of acupuncture points from the recent literature, and a chart of bloodletting points from the historical literature. And they kind of look similar. You can't see it here. It's not, doesn't show up very well. But they're basically, they kind of look like you can almost superimpose one on the other. And I thought that's a fairly interesting observation. So that seems to support an hypothesis that perhaps the action underlying both of them might, at least in part, be autohemotherapeutic. Your own blood being pushed into the tissues. Interesting, homeopathy, a little touch on this. And I've looked into all these things after studying autohemotherapy, trying to see how they relate. And about homeopathy, what I thought was very interesting was that Hahnemann used small doses and minimally invasive. And what was interesting is that he emphasized the law of similars, that if you find something, he went off into the forest and found stuff that made him sick, and then used that as medicine against the diseases that cause those same symptoms. Well, of course, the ultimate in similar is the same. So that the principle underlying homeopathy, that you want something that is similar, that causes a similar symptom, you can't get any more similar than the same. So the use of autohemotherapy is totally consistent with homeopathy. Duncan was a homeopathic doctor. Now, in the modern literature, there are some references to serum therapy, and there are references to autohemotherapy. Not all that many, but if we look in a different place, if we look for keywords of blood, serum, hemo, auto, then a number of articles start to show up. So what this is, these are autohemotherapy, very few. But when we take autologous plus blood plus therapy, all of a sudden we've got in 1990, 1994, 1,500 articles that at least had those keywords in them. And on the subject area, serum therapy, there are a lot of articles. What was interesting, when you plug in that extra word autologous, there were only 35, and we're going to come back to that. Now this is on the serum side. This is the hemo serum side, and now we're taking a look at the same type of data here for vaccine therapy, where we find when we take autologous plus vaccine, we've got a couple hundred articles. When we take vaccine therapy, we have 276 articles, 1990 to 94. And just started to pick this up. And of those, 28 were autologous. We're going to come right back to this now. I was looking at those autologous ones for both that 35 and that 28 to see what was going on with those. Because autologous, especially with a vaccine, it's much more complex than just getting a vaccine that you give to several people. And it turned out that of those small numbers, 14 of the 35 autologous serum therapy articles 14 of 35 also had the keyword cancer or tumor in them. And of the vaccine therapy articles, 26 of the 28. So what it is that what it appears is that the autologous specific treatments are being reserved for people with cancer. So they're getting the most attention, and so a lot of those are going. So it seems that conversely, that autologous therapy may bear more investigation in terms of treatment of cancer. Anyway, I thought it was an interesting observation that they're reserving that type of treatment for cancer patients. And our last slide for autohemotherapy is some recommendations. I think that this is very simple. And by the way, I perform autohemotherapy on myself every second or third day. I have a little arthritic kind of condition in my wrist, and I felt it when I was jogging, and I started to do autohemotherapy when I found out about the oral focus and so on. And I said, well, my father had some of these diseases that he passed on at a young age, from coronary heart disease, and he had stomach ulcers, and these have been related to oral foci. And so until I got myself squared away, I started doing autohemotherapy on myself, and I've been doing it for about 7-8 years. So it doesn't kill you, it's safe to do, I know that. And what was one year I still had my root canal in here that was fractured, and I had influenza, and I thought I was going to die, and my jawbone was all swollen up, and the only thing that I could do, I didn't have money for a doctor, and I didn't know which one to go to anyway. So I did autohemotherapy every day until I was over my crisis. And in the meantime, I realized that I had no sensation of pain here. So I sort of felt like, okay, well, that kind of shows that this is something that's caused by something in my blood. And so instead of doing autohemotherapy weekly, I accelerated to every 2 or 3 days, 3 days usually, 3 or 4. I'll forget about it maybe a week, and then I'll feel a little, oh, that thing feels a little sore, and then I'll remember that I'm supposed to do it. There are a couple docs down in, Dr. Shen and his wife, they're dentists, down in Laguna. They sent me an email last week, and they're both doing autohemotherapy themselves. They were asking for information about the vaccines, and I referred them to the website. And they've also started doing autohemotherapy on their patients and also on themselves. And it's, so I recommend it highly. I think it should be, if Boy Scouts are going out in the wilderness, you might as well carry a syringe with you in case you get anything that gets into your bloodstream that might cause some systemic problem. Take that blood out, use it as a vaccine right away. Especially for malaria. We still have a crisis with malaria all over the world. We have problems like with something like Ebola. If I got that Ebola thing, I'd run for a syringe because it's something in my blood, and I'm going to make a vaccine out of it, and I'm going to survive. So I worked for the Agency for International Development a number of years ago, and I still want to try to get to those people about autohemotherapy, and we will sometime. This is the end. Well, actually, we went through it pretty quickly, and as promised, we're going to close the first session. We'll take a few minutes break. We're going to close the first session here with a song. And it is Phil Ochs' song. So I said to do, yeah.